An NBC7 exclusive. A San Diego doctor could lose his medical license for abusing alcohol and powerful drugs like oxycodone. And one physician admits drug and alcohol abuse among doctors is a big problem. NBC7's Mari Payton has the story. And Mari, this particular doctor we're talking about is still treating patients.
Catherine, that's right. Dr. Samuel Gerson is an emergency room doctor at UCSD Medical Center, treating patients even though he admitted stealing another doctor's prescription pad to get oxycodone and Endicet, powerful and very addictive narcotics.
This accusation spells out the case against Dr. Samuel Gerson, how he put his medical license at risk with a DUI conviction. How he admitted that while working in the emergency room at UCSD Medical Center, he took another doctor's prescription pad and wrote himself prescriptions for the powerful painkillers, oxycodone and Endicet. The president of the local medical society says research reveals doctors have a higher rate of alcohol and drug abuse than the general public.
And it shows that there are a large number of physicians that are impaired.
Sherry Franklin says medicine is a demanding profession with a grueling and emotional workload.
And I think that's going to breed some problems with burnout, depression, anxiety, and those things lead to substance abuse of one shape or form.
The accusation reveals that last March, the DA charged Dr. Gerson with 10 felonies. He pleaded guilty on a single charge and enrolled in a drug treatment program. USD confirms Dr. Gerson now works part-time in the ER after completing his rehab program. He now submits to regular drug testing. Gerson's lawyer says his client is, quote, not an impaired physician. Rather, he is a physician in recovery, providing outstanding, high-quality care to his patients. Dr. Franklin hopes the medical board creates a drug diversion program to help doctors with drug and alcohol problems.
Physicians that were in this position or kind of felt themselves slipping into this position would then be able to voluntarily go to the diversion program and say, I think I'm starting to have a problem here. And it wouldn't be a public announcement or a scarlet letter.
The medical board ended its drug monitoring program 5 years ago after it failed 5 different audits. Critics say it failed to protect patients and did a poor job of supervising troubled doctors. Those critics, who include public interest lawyers at the University of San Diego, say doctors must be prosecuted when caught abusing drugs or alcohol. I'm Mari Payton, NBC.